de esta colección de revisiones sistémicas. Pero antes de dar inicio, vamos a dar unas pequeñas instrucciones sobre la metodología del webinar. Primeramente me presento, mi nombre es Tania Escamilla, soy especialista en comunicación del Departamento de Emergencias en Salud de la Organización Panamericana de la Salud. Y el día de hoy, todas y todas tendrán acceso a interpretación. Tenemos interpretación en español, inglés, portugués y francés, y pueden acceder a la misma en el botón de interpretación que está en la parte inferior de su pantalla. Igualmente, como ya han podido ver, tendremos interpretación al lenguaje de señas disponible. Nuestro intérprete en todo momento estará adherido o fijado a su pantalla de Zoom para que esté accesible. Para realizar preguntas, por favor les pedimos que las realicen a través del botón de Q&A o Q&A, que está también en la parte inferior de su pantalla. Por ahí introductorios a cargo de varias representantes de la Organización Panamericana de la Salud. Primeramente, quisiera presentar al doctor James Fitzgerald, que es el director del Departamento de Sistemas y Servicios de Salud en la Organización Panamericana de la Salud. James, buenos días. El webinar a tu disposición. Muchas gracias.
Muchas gracias, Tanya. A very good morning to you all. It's a real pleasure to be with you here this morning, launching this very important initiative, which is critical, I think, to the future development of health systems that are more robust, more resilient, and have the capacity to be able to respond to the future challenges, not just in terms of pandemics, but of multiple hazard emergencies, and indeed of the growing need to ensure universal access to health and universal health coverage. We, as an organization of member states, have adopted a policy to promote the development of resilient health systems that will allow us to recuperate lost public health gains during this pandemic and to accelerate us towards the achievement of the SDG 30, particularly the achievement of universal health for all. We are in a particular time at present whereby we hope to transition from this public health emergency and to accelerate addressing issues of foregone care, but in a manner that addresses also health equity and facilitates the progress towards the achievement of universal health. At the same time, we have a policy on research for health, a policy that was adopted some years ago that really calls on all member states and the organization as a whole to use evidence to inform decisions for health. We have seen this being challenged during the pandemic. We have seen the proliferation of disinformation, misinformation, and the urgent need for us to gather and garner the necessary evidence to inform decisions that will ultimately strengthen our health systems as we move forward. As such, the collection of evidences that we have prioritized jointly with our colleagues and partners, Evidence Aid, really allows us to identify and summarize best evidence that will support such decisions for health systems, but also to map out existing knowledge gaps that can be ultimately prioritized for research agendas moving forward. So what we've done with our partners, Evidence Aid, is really to present for you an overall series of 124 topics that were prioritized by experts with specific capacities in the management of health services and issues around equity and access. In addition, we will add new summaries as they become available. Central to this process has been the issue of equity, really honing in on those vulnerable populations that have been adversely impacted by the pandemic so that we can really target the necessary initiatives and decisions that will be required to recuperate their health situation and to support them as we move in the development of health systems to address their needs. PAHO and Evidence Aid have been collaborating for over a decade. And this new collection was really developed in coordination with the Unit of Health Systems and Services health systems and health services and access within the Department of Health Systems and Services, and of course jointly with our colleagues in the public health emergency teams. And I'd like to recognize here the presence of Dr. Ciro Ugarte, who's the director of that department. Evidence Aid is a global leader in evidence and really has been working jointly with us to inform the humanitarian response and to examine the issues around future emergency preparedness and response. The collection we are presenting here for you today will address issues of access, quality of care, financing, governance, knowledge use and delivery of health services, and issues around the health workforce. They are specifically relevant to the context of the region of the Americas, and they cover aspects that are specific to the issues of health equity. We were very aware and we're very conscious of the fact that our health systems need to continue to develop what we refer to as surge capacity, this critical element of resilience where the health system has the capacity to expand rapidly, address existing needs, while at the meantime maintaining essential health services. And these elements of surge capacities need to be coherently linked with issues of supply chain resilience, redistribution of the workforce, and to make sure that in the face of a pandemic or a public health emergency, we can ensure the continuity in the delivery of health services for all. And so we are very happy to present this initiative for you. We know that the collection will grow and expand as we move forward, and this year and alone this year we expect to ensure that support. We are also very happy that this tool will constitute a critical element of our support to member states, and the Bureau will continue to provide the necessary technical guidance in the analysis and the generation of evidence for evidence-informed decisions. So many thanks. With that, I will hand it back to you. Thank you very much.
Muchas gracias, doctor Fitzgerald, por sus comentarios para introducir este webinar. Y ahora damos paso al doctor Ciro Ugarte, quien es el director del Departamento de Emergencias en Salud de la Organización Panamericana de la Salud, quien también nos dará unos comentarios introductorios a este webinar. Adelante, doctor Ugarte. Buenos días.
Buenos días, Tania, James, colegas de Evidence Aid, colegas de OPS, colegas de los países que están participando y las instituciones que colaboran con el trabajo de nuestra organización. Quisiera resaltar la importancia de del desarrollo científico, pero al mismo tiempo de buscar evidencias en casi todo lo que hacemos. Y siguiendo las palabras de James, quisiera resaltar que ese trabajo que se hace en la organización, en suma, particularmente en emergencias, está vinculado a cuál es el resultado real, verdadero, práctico, cómo se traducen las políticas, los planes, las ideas y las estrategias en algo que puede ser tangible y que podamos observar, medir y de tal manera podamos ajustar nuestras orientaciones. Esto tiene una importancia muy grande en temas de emergencias, porque como ustedes saben muy bien, en las emergencias, mientras más grande la emergencia es, más compleja y más difícil de predecir cuáles son las acciones que van a resultar en el beneficio a la población que es afectada. Es por eso que en un proceso de análisis, no solo de la evidencia que ya existe, pero además trabajar y construir evidencia sobre la marcha, sobre todo en emergencias tan prolongadas como por ejemplo la pandemia de la COVID-19. Pero gran parte de lo que hacemos es resultado de esa colaboración muy intensa entre aquellos que producen la información, más bien que producen los datos, a nivel de los servicios de salud, a nivel del ámbito social que interviene en la respuesta a las emergencias, que como saben es siempre multisectorial, y al mismo tiempo utilizar esos datos para producir información. Y luego esa información poder validarla. Encontrar algunos elementos, como por ejemplo el uso de las mascarillas. Recuerdo que el trabajo que se hizo intensamente con expertos de Evidence Aid, con Cochrane, pero también con la Universidad de Durham y varias otras universidades del mundo, condujeron a quizá una de las muy pocas evidencias de la protección de las mascarillas frente a partículas respirables. El origen era protección contra las cenizas volcánicas, pero en última instancia ha servido para poner en la balanza el uso de tipos de mascarillas para proteger a la población. Y entonces ese tipo de evidencias que van hacia salvar vidas, a reducir el sufrimiento, controlar las emergencias de salud pública, pero también para encontrar cuánto de eso, de las intervenciones que hacemos, por ejemplo, en la reducción de riesgo de desastres, en la inclusión de las personas con discapacidad, en la incorporación de las poblaciones indígenas y tantas otras políticas que tenemos, ¿cuánto de eso realmente está teniendo un impacto favorable? ¿Y cómo así podemos continuar con esas políticas o ajustarlas en la medida que tenemos más evidencia? Y es por eso que este seminario es tan importante, porque va al punto central, que es el bienestar de la población. La salud de la población y el bienestar de la población es el eje central de todo lo que hacemos. Y para eso necesitamos evidencia. Muchas gracias.
Muchas gracias, doctor Ugarte, por ese importante mensaje. Y un poco antes de iniciar con el panel, que va a ser el centro de la metodología que vamos a tener hoy en este webinar, vamos a tener un primer espacio donde el profesor Mike Clark de Evidence Aid, quien es el director emérito de investigaciones de Evidence Aid, nos va a hacer una presentación de la colección. Quisiera recordarles a todos quienes acaban de unir al webinar que pueden acceder a la interpretación en cualquiera de los idiomas presionando el botón de interpretación en la parte inferior de su pantalla. Professor Mike Clark, thank you and good morning. I'll give the floor to you so you can start your presentation on the Evidence Aid collection.
Thank you very much, Tanya, and thanks also to James and Ciro for those words of introduction, which very nicely set the scene for why we've been working together as Evidence Aid and PAHO to bring evidence into easier ways of people accessing it. I'll say a few words about Evidence Aid, and then I'll tell you a little bit about what we've been doing during phase 1 of this project. It's access to good evidence. How they use that evidence, that's their job. Their job is to use the evidence in ways that will make things better for people in health and social care, that will help us to emerge from the last 2 years, will help us to achieve universal health coverage with effective and efficient healthcare. Our job, I'm an academic researcher. Our job is to generate high quality evidence. And then what we're doing in this project is making that evidence more accessible. So Evidence Aid, we are trying to improve access to reliable information to support well-informed decisions before, during, and after disasters and health emergencies. There could be rapid onset disasters due to natural hazards. They could be the challenges that we face with migration, the challenges that we're going to face even more from climate change and things like the COVID-19 pandemic. We need to be helping policymakers, practitioners, patients, and the public to provide and to receive the best care available so that they can recover as quickly as possible. And Evidence Aid as an organization was established inside Cochrane, which was then called the Cochrane Collaboration, following the Indian Ocean tsunami. And it's great to see people in this webinar, such as Luis Gabriel Cuervo, who at the time was working at the BMJ and is now at PAHO, who was partnering with us to try and improve access to evidence at that time and built the foundations for the strong relationship that we have with PAHO. We registered as a charity in 2015, becoming standalone from Cochrane. And we formalized our arrangements with PAHO in 2019 by signing a memorandum of understanding. But as James has already said, we've been working together for many years before that. And that memorandum of understanding recognizes the joint recognition of the importance of evidence-based decision-making. So why do we need this? Well, what do we need? We need high-quality research that is relevant for disasters and other health emergencies. Then we need the systematic reviews of that research, and the systematic reviews are where the evidence is brought together on a topic, bringing together all of the relevant evidence on that topic to provide the reliable and robust evidence base for the decision makers. They cannot spend their time searching for the individual independent pieces of research. It needs to be brought together. And then it needs to be summarized for them, because the review may be thousands, if not tens of thousands of words long. They need a summary, and it's that last point that we're emphasizing in this work on the Resilient Health Systems Collection, making accessible summaries of the evidence. Evidence time, and we have special collections, we call them evidence collections, in various topics. We put a large amount of effort over the last 2 years into preparing summaries of COVID-19. There's 585 summaries now available, covering 800 or 900 reviews, because we brought reviews together. But that's from a vast number, maybe 5,000 systematic reviews of COVID-19. Collections on refugees and asylum seekers, malnutrition, natural hazards, Ebola, humanitarian impact of climate change, which is a collection we're trying to strengthen, and then the resilient health systems, which is the one we're talking about today. So in phase one, and phase one took place in the second half of 2021, and we look forward so much to phase two and beyond, and working with PAHO to build on this. And my last slide for today will touch on some of those issues. So what did it require? It required the identification of relevant reviews, enhancements to the summaries that we had been producing before, enhancements to the website to make them more accessible, then the preparation of those summaries and their publication. And I'll go through each of these to just give you a sense of the foundations for what we're so pleased to be able to formally launch today. So identification of the relevant reviews. One of the challenges facing decision makers is finding the evidence. And I've already touched on the challenge of individual independent studies that need to be brought together in systematic reviews. But those reviews themselves are then scattered across the literature in hundreds of journals, on hundreds of websites. And so the first step is to try and find the relevant reviews and then work through them, screen them to see which are really relevant. And we divided the work up after prioritization by PAHO of the topics to begin with for phase one. Telehealth, ways of moving healthcare from in-person to online, which became incredibly relevant in the restrictions imposed by COVID-19, but is going to be one of the ways to improve equitable access to healthcare for people who are in remote areas. 900 searches, 900 records were identified in the search, and 200 of those were then screened for relevance. For migrants, 1,200 hits in the literature, screening 591 after many had been clear, were judged irrelevant, but still requiring these big numbers to be screened. And you have to put yourself in the position of a decision maker who would not have the time to do this work. Post-event recovery and surge, again, already touched on by James and Ciro, an increasingly important area. Capacities for delivering healthcare in rural and remote settings, protecting health workers from infection, and protecting the mental health of health workers, and mental health of victims of disasters and health emergencies. So there is a body of evidence out there, but as I've said, it is scattered. It needed to be brought together. And the green numbers are the numbers that were then screened for relevance. We also had to make the evidence aid summaries themselves better. They already contained the citation to the review, a DOI, a link to the review, and what languages the review was available in. and whether or not the review was free to view. And we've emphasized all along that our resources should be free and that ideally the underlying review should be free. We added who funded the review. This is one of the enhancements for this collection. We maintained what is this review about, what is the topic, how was it done, when did they search, how widely did they search, and the main findings. But then we added the implications. So what do the authors of the review say its implications are? And we added the equity issues, which again, James and Ciro have already touched on as extremely important components now of universal health coverage, access to health and social care for everybody. We need to see what those reviews have done about equity. And we added index categories. Again, that was a feature that was already there. So we made the reviews, the summaries of the reviews better, more accessible. Also required enhancements to the website. These are all available online. We grouped them by the categories and we cross-linked to the other evidence collections so that somebody may see something in the Resilient Health Systems collection that is also relevant to COVID-19 or is also relevant to delivering healthcare after a major windstorm. We added the ability to put a portal, to put a screen, a window on other websites so that you could then search into the collections without having to come to the collection itself. You could be on a PAHO website, you could be on another website, and you could go in through this portal or through this window to the collection. And a really important enhancement, the ability to download the summaries and the citations for the reviews themselves into reference management software, into software that would allow people to manage the information for themselves. And then preparing the summaries, and this, is also to give acknowledgement to the people that helped as part of this project, to Claire Allen and Jane Cotsby, who are key members of the Evidence Aid team, and organised a large extent of the project with Yasmin Saeed and Anna Pizarro acting as junior researchers, Faraz Khalid as the senior researcher, checking everything. We piloted working with Luis Gabriel Cuervo and Alex Camacho to make sure that what we were preparing was what you wanted. Each of the summaries was approved by myself as research director, then translated into French, Portuguese, and Spanish, and published on the Evidence Aid website. So a large amount of work and a large amount of checking of the reliability, checking of the relevance, checking of the accessibility of these summaries. As James said, 124 have now been published as phase one, covering many of the priority areas. And I'll just list the priority areas again, and the numbers now are how many summaries are there. 17 summaries of telehealth, and the number adds up to more than 124 because some of them fall into more than one priority topic. Migrants, 20, post-event recovery and surge, 33, building capacities for people in rural and remote areas, 23, infection control to protect health workers, 14, strategies to help protect the mental health of health workers, and strategies to protect the mental health of disaster victims. We're on the beginning of the journey, 124 summaries there. There will be a need for hundreds of summaries. And so what's next? It's a living collection and an evolving process. Material needs to be added. Further enhancements will be needed. More summaries will be added for those phase one topics. We will expand to include more priorities for PAHO, including some of those big challenges that we're facing now as a world and that the Americas are facing, climate change and migration. And those further enhancements to include perhaps adding the implications of the review, not of the review authors, but of policymakers. What do they feel these reviews should lead to for current practice and for future research? And the ongoing collaboration with PAHO. So we make the collection as useful as possible to PAHO, the Americas, and also strengthen its global relevance. And it's great to see people such as Kazia here, who will be speaking in the panel shortly, to see and think about how this could become a global resource. So I'll finish with the URL for the collection. I decided not to show individual examples of the summaries. This is to give you that overview, 124 summaries, all in one place now, dealing with things that will help you, us, everybody improve the resilience of health systems. Thank you very much. I'll pass back to Tanya.
Thank you very much, Professor Clark. Muchísimas gracias, Mike Clark. Aquí les acabo de poner en el chat el link al que Mike estaba haciendo alusión. Es el link en el que podrán acceder a la colección que nos acaba de presentar muy detalladamente con todas sus funcionalidades y posibilidades, tanto a nivel metodológico, técnico, como conceptual y estratégico, en la búsqueda de esas evidencias que nos permitan mejorar la preparación y la respuesta y la capacidad de los sistemas y servicios de salud para responder a diferentes emergencias. Y con esto quiero dar paso a nuestro panel. Ya Mike nos había comentado y yo también que tendríamos un panel el día de hoy. Y nos acompañan dos expertas que nos con quienes vamos a debatir un poco la perspectiva global y la perspectiva también en los países, que por supuesto es importante porque es donde fundamentalmente se va a poder apreciar la funcionalidad que tiene la nueva colección. Entonces quisiera presentar el día de hoy, les pido que enciendan las cámaras, a Paola Pontoni, quien es directora de desastres del Ministerio de Salud de Chile, y a la doctora Kutsia. Ay, perdón, doctora, si estoy dando su I'll leave it to you so you can pronounce your name because I'm so embarrassed to say it badly. Please go ahead, Dr. Kutsia.
Thank you very much. I'm very pleased to be here today. You said my name very nicely, actually, better than me.
Great, thank you.
So good afternoon from Geneva. Very honored to be invited at this important event to listen to you all. Delighted to be part of this panel as well and sharing the panel with this expert and then the director from Chile Ministry of Health, Ms. Dr. Paola. And also thanks for giving me the opportunity to share my thoughts around this topic. Thanks to PAHO for creating this opportunity and inviting me. I will come up with a bit long story, and then please bear with me because I need to make my case. That's where we need the evidence. That's where we need the information. We all know that millions of lives and livelihoods are impacted by health emergencies and disasters every year. This impact of emergencies and disasters, however, is often most heavily felt amongst the vulnerable populations. COVID-19 has been no exception. Preliminary estimates suggest that the total number of global deaths attributed to the COVID-19 pandemic only in 2020 is at least 3 million, representing 1.2 million more deaths than officially reported. As our Director General, Dr. Tedros, has stated, the pandemic has magnified the divisions in societies with the impacts borne disproportionately by the most vulnerable. It comes at a time when we can no longer fail to acknowledge the direct link between the health of populations, environment, and economic and social systems. We can't do all these things. We can't actually establish the linkages and take the right actions without any information, any evidence. While the world's attention has been focused on COVID-19 response efforts, countries have been continuously facing other emergencies like hurricanes, outbreaks, flooding, earthquakes, and not to mention the prevailing humanitarian crisis resulting in stretched health system, including health workforce, challenging the essential healthcare services for maternal and child health and other communicable and non-communicable diseases, etc. So I would like to share some numbers with you all. From this recent survey that was conducted, it shows that 91% of countries reported at least some level of disruption of essential health services in Q4 of 2021. This Pulse survey also reported that 40% of countries report increased backlogs in multiple health services in the second half of 2021, including cancer care, NCD care, and rehabilitative care. Nearly half of countries reported disruptions to both routine facility-based and outreach immunization services. The reason I'm actually sharing this information with you that it's not only the numbers in terms of impact, but also which part of the year it happened. It has got some implications because these numbers are changing the games every day, helping in making decisions, interventions, and impacting actions, including the research priorities. These are important, very important to make our case. The pandemic has exposed the fragilities and gaps of health and all other systems everywhere across the world, which grossly impacted countries' socioeconomic sectors, pushing the already vulnerable populations towards the extreme poverty line. Vulnerable populations already living in poverty are often disproportionately hit by any crisis, emergencies, and disasters. Among all highly vulnerable populations, risk from different hazards, including epidemics and pandemics, and climate-related emergencies are closely interconnected, and multiple concurrent emergencies can exacerbate each other's impact, depleting communities' resilience and pushing them beyond their coping capacities. Actually, what is happening? That's what we need to know, always. The pandemic has affected populations in situations of fragility, conflict, violence, and other vulnerabilities particularly hard, especially displaced populations. Therefore, now more than ever, it is critical to maximize the available resources, be it finance, human, and others, to manage risk from multiple hazards. Countries must know and be prepared for the right threats, as the countries and communities are not facing only one at a time, unfortunately, but many. That's why it is important for the countries to develop capacity system mechanism efficient enough to manage multiple risks using a right-based approach to be inclusive for equity. These are all very big words that I have mentioned, and then these big words are actually very important in taking our actions based on what? So we are working with the countries to adopt the all-hazard health emergency and disaster risk management measures, which should be integrated into any emergency actions, following a right-based multi-sectoral approach based on systematic risk and vulnerability assessments to guide preparedness and response planning and allow countries and communities to act in a more anticipatory manner and facilitating most effective use of limited resource, as I just mentioned. Health emergency and disaster risk management allows countries to consolidate available evidence, map in-country risk, and apply the risk evidence to better inform planning, capacity development, and other key actions across the emergency management continuum that my previous colleague speakers, they have already mentioned, from mitigation, preparedness, response to recovery, for strengthening health system, which is a precursor of whole of society resilience, from governance, systems, and to communities. This also includes the continued efforts on safeguarding health facilities at all levels and improve their resilience with a focus to primary care. We have heard from our colleague, Dr. James Fitzgerald, that resilient health system is key to universal health coverage. And also I would like to pull in the discussion on the health security. It is equally important for health security as well. Adoption of all hazards health emergency and disaster risk management measures to capacitate health system accelerate that process of resilience, ensuring equity and sustainability. This is also key to achieve sustainable development goals in countries. So just one more information, that PAHO survey that I was referring, results says that nearly half of countries have plans in place for building longer-term health service recovery plan to strengthen resilience and preparedness, with an additional 40% of countries don't yet have recovery plan in place. I see that this is an opportunity, and this is a perfect timing to discuss this issue and how we can use these whole evidences that have been generated into that recovery process to build better for future. So why I have been sharing all those information today? It's only because to reflect on how important the information is to use as evidence for a better efforts for emergency and disaster risk management. Collecting information, analyzing it, presenting and reviewing information with periodic review, as we have heard from Mike, is key. It needs to be a continuous process and sustainable. It also needs to be based on standards, and also the effort we all should make to make all this information in one point, so that the standard information are used to harmonize all the actions across the board, again, directly linking it to the resources, which are very skimpy all around. I would also like to refer to authentication of those evidences as well. You all know that during this pandemic, misinformation has become a big challenge, and the Infodemic program was launched by WHO to address this challenge. This is not only responsibility of health sector as well. Making health system resilient should be a task of all in societies, all in governments. That's why making the evidence needs to be, for the betterment of health system, is the responsibility of all. We have learned this in a very hard way during this COVID-19 pandemic. Collaboration of stakeholder sectors is hence the key. To enhance such collaboration among all relevant sectors in emergency and preparedness, WHO leads many efforts on integration of health emergencies and disease outbreak in national disaster risk management strategies by bringing together relevant stakeholders from different sectors in the development of national emergency response operations plan as well. This is a very important contribution, I would say, to a risk-informed and inclusive COVID-19 recovery that builds resilience for future emergencies, including pandemics. That's why I would also like to highlight that further need in this area, further need for developing evidence in this area is critical. Information and evidences around risk, vulnerabilities, and also how to make our investment cases. Such policy level actions require evidence to make investment cases, as just mentioned, which helps in drawing resources towards health system improvement for resilience. We need to carefully note all the lessons, all the experiences of this current pandemic, the interconnecting risks, interconnecting impacts, interconnecting sectors, governance, communities, whole of societies, the global leaders, as all of us, as the health workers, on how all those reacted, what we will have done, and what we all could have done to reduce the sufferings, reduce the unavoidable deaths, to reduce the socio-economic loss during this pandemic. These are very important. Such evidences are crucial. Such evidences are critical to build a better world for future, where the communities are prepared for any unseen, unpredictable threats. Whole of society is engaged with all possible ways and means. Governance is agile to take up the challenges, and equity is preserved. We need to do everything in our capacity to build those evidences and to use them in building the post-pandemic world, which is prepared enough to save more lives, lessen sufferings to make up to the lost childhood of the children during this pandemic. We'd rather not forget that each of us will only have one chance in the lifetime to make the world a better place. Let's do it together and for a better reason. Thank you, and back to you.
Thank you very much, Dr. Huda. Muchísimas gracias, doctora, por darnos esa visión desde la Organización Mundial de la Salud y el trabajo que están realizando desde el Programa de Emergencias en Salud con los países, precisamente para mejorar las decisiones que se toman a nivel país, basándose en la evidencia en temas relacionados con el manejo del riesgo. Y con eso quisiera pasar un poco a Chile, de donde nos acompaña nuestra otra experta, que es la directora de Desastres y Emergencias de Salud del Ministerio de Salud de Chile, Paola Pontoni. Muchísimas gracias por acompañarnos el día de hoy. Y quisiera un poco continuando la conversación en cómo esta colección y cómo esta evidencia puede impactar el trabajo de los países. Usted que está en la primera línea todos los días, cuéntenos cómo cree usted que esta colección puede mejorar ese trabajo desde un país.
Gracias, Tania. Buenos días, buenas tardes y buenas noches a todos. Hay diferentes horarios de quienes estamos conectados hoy día acá. La verdad que para contextualizar un poco de cómo, desde Chile lo podemos ver, como ustedes bien saben, Chile, muchos dicen que es un laboratorio de desastres. Lamentablemente tenemos muchos desastres de origen natural, se han ido sumando los antrópicos, y como bien dijo Mike, dijo James, y el resto de los oradores que me antecedieron, cambio climático es un tema que muchas veces lo veíamos como un desastre diferente, aparte, pero resulta que tiene un gran efecto sobre la salud de las personas y también sobre los sistemas de salud, obviamente. Entonces, si vemos esto, y como lo dice la doctora Juda, aquí hay un tema también en relación a cuáles son estas enfermedades emergentes, esta pandemia que nos está ahora, ¿cierto?, nos tiene a todos trabajando en forma ardua para salvar el máximo de vidas posible y poder volver luego lo antes posible a la normalidad nuevamente, o a la posible normalidad que podamos llegar. Se suman otro tipo de enfermedades emergentes y reemergentes asociadas a múltiples causas, como son cambio climático, sean sequías, ¿cierto?, olas de calor, reapariciones o digamos, de otros vectores que también, digamos, están poblando o repoblando otras regiones, y eso no es algo que solo se vea en ciertas regiones de Chile, sino de las Américas y también de otros países de otras regiones, que es algo que nos preocupa enormemente. Por lo tanto, eso a nosotros, desde el punto de vista de esta colección que nos presenta Mike, donde tiene la gran ventaja de concentrar el conocimiento con la mejor evidencia disponible en un solo lugar, donde quienes trabajamos a diario en lo que es la gestión del riesgo de desastre y donde también los tomadores de decisión pueden llegar a esa información ya, ¿cierto?, más categorizada, resumida, nos puede apoyar en poder generar nuevas políticas públicas, en poder fortalecer las políticas ya existentes, en reformularlas. Y es muy importante, si bien ahora lo que nos convoca es los sistemas de salud, ¿cierto?, el fortalecimiento de los sistemas de salud, yo diría que la colección que presenta Mike, la verdad que todos los temas que aborda confluyen en un sistema de salud resiliente. Si vemos migración, si vemos cambio climático, si vemos, digamos, ¿cierto?, ahí hay temas que tiene sobre Zika, sobre chikungunya y otro tipo de enfermedades, nosotros deberíamos poder trabajar en planes multiamenaza, ¿cierto?, en donde también debemos generar nuevos mapas de nuestras capacidades de los sectores de salud y que mejor teniendo evidencia sobre las amenazas de la región, y si hay alguna brecha, cómo incentivar a que se trabaje sobre aquello que falta estudiar para poder incorporar las políticas públicas. Como bien sabemos, las políticas públicas tienen como sentido el poder salvar, ¿cierto?, el mayor número de vidas, en políticas globales, en políticas que no solo sean digamos, de resorte nacional, sino también pudiésemos trabajar como región en forma, digamos, ya sabemos que, ¿cierto?, la globalidad de nuestro mundo hoy, así nos vimos con la pandemia, que surge para nosotros, para Chile, era un sitio muy remoto y muy lejano, pero no tardó mucho en llegar, y todas las implicancias que esto tiene para el sistema. Una pandemia, como bien lo dijo la doctora Juda, no solo implica consecuencias en salud y en los sistemas de salud, son el sistema económico, el sistema social, el cómo se empobrece una parte de la población o un país, cómo eso genera problemas en la salud mental, tanto de la población general como de los trabajadores. Yo creo que insisto en que la riqueza de este sitio, de este base de datos que nos entrega información, y una información ya que ha sido revisada, que nos dice cuál es el nivel de evidencia al cual nosotros podemos, ¿cierto?, adscribirnos para poder trabajar en nuestras políticas, y si podemos seguir trabajando con OPS y OMS, a ir generando otras instancias de investigación que puedan apoyar digamos, a nuestros países a generar no solo un sistema, sino países más resilientes a desastres, y donde cambiemos el paradigma de trabajar desde post-desastre, de cómo generamos, porque la mayoría de las políticas en desastre o las mejoras en normativas han sido posterior a un desastre. Lamentablemente, tenemos que cambiar de lo correctivo a lo prospectivo, y yo creo que eso es un gran aliciente y es un gran aporte que nos está generando la academia, los institutos de investigación, y es donde tenemos que aprender a invertir sobre ello para poder mitigar y prepararnos para futuras emergencias, no solo de tipo biológica como la pandemia, sino también de tipo sociales, tecnológicas y otras que nos puedan afectar a todos los sistemas de salud.
Muchas gracias, Paola, por esa perspectiva desde tu quehacer diario en tu cargo actual y en un país. Quisiera recordarles a todos quienes nos acompañan que pueden realizar preguntas a través del Q&A. Y Paola, para seguir contigo, yo quisiera preguntarte ¿qué tipo de temas o áreas crees que deberían ser incluidas en esta colección? Porque sabemos que esta colección está viva, que va a seguir expandiéndose, nos los explicó Mike y otros de los panelistas que hemos tenido el día de hoy en la sesión introductoria, pero desde el país y desde tu área de trabajo, ¿qué temas serían importantes incluir? ¿Y qué otras colecciones de las que conoces de Evidence Aid pueden también informar un poco el trabajo técnico que se realiza desde el país?
Bien, Tania, en relación a ello, la verdad que los recursos que tiene, ¿cierto?, digamos, la base de datos de Evidence Aid, tenemos, ¿cierto?, desde lo que son los eventos de origen natural, hay mucho que nos habla de terremotos, de ciclones, ¿cierto? También tenemos de cómo afecta, ¿cierto?, lo que decía Mike de los trastornos postraumáticos, es importante de cómo manejamos tanto de la población en general, vuelvo a insistir, como de los equipos de salud. Esta pandemia ha sido, digamos, clave en poder ver cómo un desastre como esta pandemia, una catástrofe como esta pandemia, que no es de origen y de término súbito, sino que es algo ya de larga data y crónico, afecta y desgasta los equipos de salud, y cómo generar políticas en ello. Yo creo que la evidencia que se ha ido generando en ello y cómo podemos avanzar en aquello es muy importante. Yo creo que ahí el equipo de Mike tiene un gran desafío, porque si bien tenemos cosas incipientes, y muy, digamos, dentro del desastre, aún trabajando en cómo ha ido afectando la pandemia, va a ser muy enriquecedor cuando demos, digamos, por cerrado el ciclo y veamos en forma retrospectiva, con datos ciertos, cuáles fueron los principales cuadros que afectaron a la salud, tanto mental como física, de los equipos de salud, cómo esto generó o cómo esto impactó en los sistemas de salud, el nivel de ausentismo, los tipos de ausentismo, el cómo se recuperan los sistemas de salud. Creo que ahí hay un tema de cómo generar, digamos, sistemas de salud digamos, la disrupción o la interrupción del servicio, quizás estudiar qué tipo digamos, de servicios fueron los interrumpidos. Lo hemos visto también cuando hemos tenido que, digamos, monitorear lo que es pandemia para, digamos, el marco de Sendai, y donde nos piden valorizar las pérdidas. Y yo creo que si valorizamos la pandemia, que no tenemos establecimientos destruidos, pero sí tenemos servicios que no hemos dado, tenemos personal que ha sido afectado, tenemos vidas perdidas, tenemos secuelas de la pandemia, tanto en equipos de salud como en personas. Si logramos evidenciar aquello, también nos puede servir, como también lo ha hecho OMS o OPS, que está, ¿cierto?, propendiendo a que haya un fortalecimiento del reglamento sanitario internacional en ciertos ámbitos que permitan reforzar lo que hace el reglamento, y también que permita el cómo nos apoyamos entre los diferentes países, siendo que, insisto, en la globalidad de los desastres ahora es mucho mayor. Antiguamente, o sea, no éramos, digamos, las conexiones eran mucho más, ¿cierto?, lentas. Ahora sí, digamos, podemos tener esta transmisión más rápida y poder ser afectados por otros, digamos, por este tipo de eventos. Por lo tanto, creo que hay que trabajar quizás en ir reforzando en algunas líneas de trabajo tanto las amenazas como los riesgos. Bueno, tenemos también, ¿cierto?, el impacto de cambio climático, tanto en la población, como tal, cuántos estudios de carga de enfermedad asociado a cambio climático. Yo creo que es un tema que tenemos que llevar a cabo, porque eso sí nos va a generar también hacer sistemas de salud más resilientes, porque vamos a saber dónde también invertir, qué tipo de equipos de salud más especializados necesitamos, dependiendo, ¿cierto?, cuál es el efecto en cada una de las regiones. Porque en todos lados afecta de diferentes formas. En algunos lados tenemos mayor cantidad de deslizamientos de tierra, inundaciones, como vimos hace poco en Brasil, que lamentablemente, ¿cierto?, cobró varias vidas. Y así tenemos que ver cómo esos sistemas de salud responden a aquello, dónde instalamos nuestros nuevos establecimientos de salud, cómo mitigamos cuando no tenemos otras opciones donde instalarlo. Yo creo que, insisto, Mike, y esperamos ahí poder seguir viendo cómo evoluciona esta colección, porque la verdad la vi y me encantó, me gustó mucho cómo la tienen, digamos, clasificada, y cómo por el nivel de evidencia yo sé dónde debo buscar. Si veo que tú me dices que hay estudios que tienen bajo nivel de evidencia, obviamente si no hay más tendré que revisar y ver dónde podemos también como país ver cómo avanzar. Pero creo que es una muy buena herramienta para los tomadores de decisión y para los equipos que estamos acá, de cómo aportar y cómo apoyar a los tomadores de decisión en generar políticas prospectivas para mitigar el riesgo de los equipos y, digamos, y tener el sistema de salud más resiliente.
Muchísimas gracias, Paola. Y también hemos recibido una pregunta para la doctora Huda. Quisiera volver con ella. La voy a leer en inglés. What challenges, Dr. Huda, do countries face to have better evidence-informed decisions on emergency and disaster risk management?
Thank you very much for this question. I think that this is the question. It's a question of the day, I would say, because this is where the problem is, and this is where the solution is as well. First of all, at the country level, the main challenge is that risk information is not available in many cases. Risks were never been prioritized. And then again, accessibility to risk information is not there. So this is one of the key challenge, I would say, that in countries to make evidence-informed decisions for emergency and disaster risk management. I think that this is why it's very important that we create that risk profile for countries. We create that risk information for the countries and evidences around this risk vulnerabilities and capacities. The second point here is that the risk information is completely disconnected from the decision-making process, completely disconnected from the resource allocation, because risk information has been all this time, like, even though some countries, they do develop their country risk profile, they do collect their risk information, but somehow it remains in an academic envelope, I would say. It's not seldom it's been used for application in taking action. So this needs to be bridged. So that's another challenge I would like to mention. Another very important factors from my experience, that in WHO we developed these methodologies, we call it STAR, Strategic Toolkit for Assessing Risks. So we have by now applied in 74 countries this methodology to develop the risk profiles. And then you can imagine these 74 countries, they have their own risk profile, they prioritize risk, they prioritize their actions around that as well. And then the whole methodology is as such that it brings in all the stakeholders together. Then where is the problem? So when we started going back to the countries and see that how many countries have actually used this information, this is where we got started, because this information are not really presented. This information, I think that Professor Mike mentioned during his presentation, the importance of wrapping, packaging this risk, how you can make it visible, any information. So this is a problem. And also another problem we have noticed in the countries, that countries are very shy or very sensitive to share their risk information with others. And then This, I would say, it's a misconception, because if you share your risk, there's more opportunity for taking risk-informed action. If you don't share your risk information with all your stakeholders, there is a more probability of taking actions which are not actually priority, which are not connected to the actual need on the ground. So I think that this is very important to also look into this. The reason the risk-based action in a country, it varies from countries to countries. Say, for example, in small island developing countries, their needs for this, for risk-informed actions would be very different than need for risk-informed action in other countries. Maybe in the protracted emergency countries or countries where the emergencies are not quite often. So that's a reason we cannot say that one size fits for all, that there is a rule of thumb. Only rule of thumb is assessing your risk, identifying your risk, packaging your risk. Okay, so I think that three things I would like to highlight here. I would also refer to Dr. Paula, who mentioned international health regulations and Sendai framework. These are the two very big and important global instruments which countries are responsible to report to and which countries actually agreed to implement. And both these two global instruments actually highlights the need for assessing the risk at the country level. Because this is the main challenge, that not having the evidences and information around risk. I think that prioritization of risk and taking the risk from presentation of the risk to take the risk-informed action from prevention, preparedness, response to recovery would be key. Second thing, I think that would be very important to create that risk-informed governance. This risk-informed governance, and actually as a part of whole of society, would further facilitate to take forward and advance this health emergency and disaster risk management in the countries, and also contribute in getting the evidences. Last but not the least, I think that it is very, very important to not only to identify the risk, creating the evidence, but also using these evidences in mobilizing the resources and allocation of the resources. Because our resource allocation and our decision of resource mobilization is often very disconnected from the risk. So I think that what we are discussing today, we need to create more evidences, we need to create more information, ensuring not only the generation of information and also ensuring the accessibility of this information to take those actions, to take risk more closer to the decision making, to more closer to the governance, and more closer to the resource allocation and resource mobilization. That's how we can actually advance the emergency and disaster risk management more, and we can say that these are the evidences we can use in there, and we will be able to overcome the challenges. Again, just going back to what I just said in my last intervention, this is not the job of only health sector. This is not the job of only one sector. We all need to work together. We need to find out ways and means how we can create that platform to put all our efforts together. I think that what evidence aid that just shared with us, that some of the areas they have created the evidence, they have generated the evidence, and then I think more needs to be done, and where we have our commitment to work together jointly with them. Thank you, and back to you.
Disculpas. Thank you, Dr. Huda. Thank you very much for that recount on a very integral view on how the countries need to use the evidence, not only in the disaster phase, but also in the preparedness and in the planning of a disaster phase. Thank you very much. Muchísimas gracias a la doctora Huda y a Paola por la participación en la sección del panel. Quisiera saber si alguien de los que está presentes en el público tiene alguna duda o inquietud o aporte, comentario que nos quiera hacer a través del QIA, o también podrían usar el chat. Tenemos un aporte de Claire Allen, quien hace parte del equipo de Evidence Aid, en la que nos recuerda que si alguien está interesado en recibir actualizaciones regulares de Evidence Aid, pueden enviar un email a info@evidenceaid.org para que puedan recibir el newsletter que envían con ejemplos de algunos de los resúmenes sistémicos que ellos ofrecen en la página web. Entonces, muchísimas gracias a todos. Quisiera finalizar un poco, hemos llegado a la hora, recordándoles que el 15 de marzo estaremos presentando la segunda versión del curso sobre evaluación de establecimientos de salud en el índice de seguridad hospitalaria. Esto está enmarcado dentro de la iniciativa Hospital Seguro que tenemos en el Departamento de Emergencias en Salud de la OPS. Si siguen nuestras redes sociales, @PAHO Emergencies en Twitter y en Facebook, ahí podrán encontrar mayor información sobre la presentación de este curso que estará disponible en español y en inglés y que se realizará el 15 de marzo. Finalizo dándoles las gracias. No sé si Alex quieras dar algún comentario final.
Tania, muchísimas gracias y nuevamente gracias a todos nuestros invitados y a nuestros panelistas y por supuesto a Evidence Aid. Para cerrar con broche de oro, pues vamos a darle la palabra a Luis Gabriel Cuervo, quien va a hacer el cierre de esta sesión. Muchísimas gracias con todos. Adelante, Luis Gabriel.
Muchísimas gracias, Alex, y quiero hacer ese reconocimiento al trabajo extraordinario que se ha hecho. Hemos oído de la excelencia con que se ha hecho el trabajo, de las competencias increíbles que se han traído, y yo quiero rescatar pues un par de puntos. Uno, sí, en la parte operativa ha estado toda esa excelencia usando la gente con las mejores, digamos que viene la gente con las mejores competencias a los equipos. Y en Evidence Aid y en la OPS han habido equipos grandes detrás de todo este trabajo, no solo las personas que hemos tenido la oportunidad de hablar. Pero también quiero hablar un poquito, muy brevemente, sobre la estrategia y la visión. Y me encantó cómo lo trajo a colación la doctora Pontoni, porque un elemento esencial de todo lo que se ha hecho ha sido partir de cuáles son las necesidades de quienes están utilizando o requieren utilizar esta información y por qué. Y un elemento fundamental en esto es por poder construir confianza. Es algo que hemos visto que en la respuesta y en la resiliencia es esencial, es que haya confianza en lo que se está haciendo, confianza en la comunidad, confianza en quienes toman las decisiones. Por eso, pues hay que ir a ver cuáles son esas necesidades y atender esas necesidades, y yo creo que es muy importante destacar que en este proceso ha habido esa interacción con quienes tienen que tomar las decisiones en temas de sistemas de salud resilientes, en temas de respuesta a la emergencia, de la continuidad de los servicios, de ver qué es lo que necesitan para responder a ello desde la evidencia. Que esta colección no está sucediendo en el vacío, sino sucede para llenar una necesidad sentida y está mirando hacia el futuro, adelantándonos, como decía Paola, a los eventos para poder estar preparados para ello. Y ese era el punto final que quería hacer de cierre, agradeciendo la participación, muy contentos de tener la acogida que ha tenido este evento y de tener unos equipos extraordinarios detrás respaldándolo para que continúe, siga creciendo y sea de utilidad en las Américas y más allá. También con todas las organizaciones que hacen uso de estos conocimientos. Muchas gracias.
Muchas gracias, doctor Cuervo, por esos puntos finales. Muchísimas gracias a todos y a todas quienes han podido participar el día de hoy. Alex, no sé si quieras dar algún final remark.
No, solamente reiterar nuestro agradecimiento a todos quienes han sido parte de este proceso y por supuesto a los países, quienes son los usuarios, quienes son los actores principales y para quienes y con quienes hemos hecho el proceso. Reiterarles la invitación, el próximo 15 de marzo estaremos haciendo la presentación del curso de autoinstrucción de evaluación de establecimientos de salud a través del índice de seguridad hospitalaria versión 2 y de igual manera pues ustedes serán los actores principales de este proceso. En breve les vamos a dejar el link en el chat y de esa forma pues esperamos que nos puedan acompañar. Gracias Tania por tu moderación, muchísimas gracias Luis Gabriel, un honor trabajar contigo, Kutsia, Paola y Mike, por supuesto, el apoyo de Evidence Aid y de seguro vamos a seguir trabajando en este proceso. Muchísimas gracias, Ciro, James. Una buena tarde a todos. Gracias.
Muchas gracias a todos y saludos
Thank
desde
you,
Washington.
everyone. Bye-bye.